Bismillahirrahmanirrahim. I am Dr. Osama Elshafeie. We'll talk today about an introduction to the neuroanatomy. And of course, we can't cover all the aspects of neuroanatomy in one lecture. And we will cover or revise the basics of the neuroanatomy. And we will focus on some important points related to neurology. The nervous system is formed of two divisions, central and peripheral parts. Central part contains the brain and spinal cord, while the peripheral part contains the nerves and the neural tissues. For description of a location of a lesion or description of the anatomy of the nervous system, we use some terms like dorsal or ventral. Dorsal toward the back and the ventral toward the stomach. Anterior or posterior, superior, inferior, lateral, and medial. If you look here, this is the medial view of the left half of the brain. This is the anterior part, and this is the posterior part. This is the ventral part towards the stomach, and this is the dorsal part away from the stomach. The same directions is applied for the lateral view also of the brain. This is the anterior part, posterior part, ventral and dorsal directions. Proximal and distal. Proximal is located close to the point of origin or attachment, while the distal part is the more or the most distant part from the point of origin or attachment. Ipsilateral and contralateral. Ipsilateral lesion, it means it is on the same side of the body, while contralateral lesion means it is on the opposite side of the body. Again, this is the lateral part of the brain, and this is the medial part. This is the anterior or rostral part, and this is the posterior or caudal part. This is the ventral part, and this is the dorsal part. We have three planes of the brain: the coronal, sagittal, and the horizontal views. The coronal section or the frontal section is a vertical section or vertical plane that divides the brain into anterior and posterior parts, and the section looks like this. The horizontal section is a transverse section that divides the brain into superior and inferior parts. The sagittal section is a vertical section that divides the brain into right and left parts. So this is the brain. We have the three sections or three planes, two vertical and one transverse. The transverse divides the brain into superior and inferior. The sagittal divides the brain into right and left. The coronal section divides the brain into anterior and posterior. So how the nervous system is organized? We said we have two parts: central nervous system and peripheral nervous system. The central nervous system is connected to the peripheral nervous system by fibers or tracts. The motor fibers carrying the commands or the orders from the central nervous system to the peripheral nervous system, and this is called the efferent neurons. And the peripheral nervous system carries the sensory impulses and sends them to the central nervous system through the afferent fibers. So afferent fibers come from the peripheral to the central, and the central sends the commands or the orders along the efferent neurons to the peripheral nervous system. The peripheral nervous system is two parts: somatic nervous system, which sends the fibers to the skeletal muscles and voluntary muscles, and the autonomic nervous system to the cardiac and smooth muscles and glands. which is either parasympathetic or sympathetic nervous system. Okay, the peripheral part of the nervous tissue is formed of neuroglial cells and the neurons that transmit the nerve impulses, and the neuroglial cells, they are the supportive cells. They support the neurons and protect them. The neuroglial cells or tissues within the central nervous system include the astrocytes, which is the supportive cells, the microglia, which remove the debris and act the macrophages, the ependymal cells, which lines the canals and the cavities, the oligodendrocytes, which is responsible for myelin production. While in the peripheral nervous system, we have two types: Schwann cells that form the myelin as the oligodendrocytes within the central nervous system, and the satellite cells. As regards the neurons, we have three parts: the axon, cell body, and the dendrites. The dendrites send the information to the cell bodies, while the axon carries the information away from the cell body. The neurons can be classified according to the function into sensory neurons, which send impulses towards the central nervous system, and the motor neurons, which carry the command or the orders away from the central nervous system to the peripheral nervous system. The interneurons, which connecting or form bridges between the neurons. And this will be a brief review about the anatomy of the central nervous system, starting from the meninges. The meninges, which surrounding the brain and the spinal cord and protects them. They are three layers: the dura mater, arachnoid, and the pia mater. The dura is the outer thick layer, arachnoid is the middle layer, and the pia in the inner layer which envelopes the brain and the spinal cord. We have three parts. This is the skull bone, right? And this is the brain. This is the dura mater, which is the outer thick layer, the arachnoid mater, and the pia mater, which is the inside membrane or the membrane just surrounding the brain. This is a more detailed image of the meninges. This is the pia, a small delicate membrane surrounding the brain. This is the arachnoid, and this is the subarachnoid space which is containing the blood vessels, and this is the dura outer thick layer. As we know, brain and spinal cord are surrounded by a fluid which is the cerebrospinal fluid, and its function is to reduce the weight of the brain. This CSF is contained within a cavity called the ventricles, and it is produced by the choroid plexus. This is a simple diagram for the ventricular system. We have two lateral ventricles, then the third ventricle, aqueduct sylvius, the fourth ventricle, then the central spinal canal. Uh, After the meninges, we have the outer part of the cerebral hemisphere, which is the cerebral cortex, which is the outer part of the cerebral hemisphere, which is gray in color. And this gray color comes from the cells that forms the cerebral cortex, which is formed of 6 layers of cells. And it is convoluted by grooves, which may be sulci or fissures. The sulci is the small grooves within the cerebral cortex, and the fissures, which are the large grooves which is separating the loops from each other. So the cortex can be divided into four loops: frontal, parietal, occipital, and temporal loops. The small grooves here is the sulci, okay, and the large grooves like this is the fissures. This is the central sulcus, which separates the frontal loop from the parietal loops, and the lateral sulcus, which separates the frontal and parietal loops superiorly from the temporal loop inferiorly, and this is the longitudinal fissure, which separates the brain into right and left hemispheres. We have four loops. As we said, this is the frontal, parietal, the posterior part here is the occipital, and this is the temporal loop. From this view, this is the frontal loop, parietal loops, occipital loops. The cerebral hemispheres are divided into right hemisphere and the left hemisphere by the longitudinal fissure, but they are not completely separated from each other. They are connected together by a bridge which can transfer information from one half of the brain to the other half, which is the corpus callosum. The two halves of the cerebral hemispheres are identical or physically similar, but the function is different. The function of some areas in the right hemisphere is completely different from the same areas in the left hemisphere. Some deeper structures within the brain, like the basal ganglia, the thalamus, and the hypothalamus. For example, the basal ganglia are a collection of subcortical nuclei, which includes the globus pallidus, caudate, putamen, and they have an important role in the control of movement. So the thalamus and the hypothalamus are part of the subcortical nuclei. Brainstem is an important part of the central nervous system that have many centers for many vital functions for the body. It includes the midbrain, pons, and medulla. The midbrain is the upper part of the brainstem. It controls the visual reflexes and hearing reflexes. The pons is the middle part of the brainstem. The medulla oblongata is the lower part of the brainstem. The cerebellum, which is the second largest part of the brain after the cerebral hemisphere, and it has important function in the coordination of the voluntary and involuntary movement and adjustment of the muscles to automatically maintain the posture of the body. The cranial nerves, we have 12 cranial nerves. The first cranial nerve is the olfactory cranial nerve, which is responsible for the smell. The second is the optic, which is responsible for the vision. Third, fourth, and sixth cranial nerves, oculomotor, trochlear, and the adjacent cranial nerves, are responsible for controlling the eye movement. Fifth cranial nerve, the trigeminal nerve, which carries a sensation from most of the face and the motor function of the jaw muscles for chewing and mastication. Seventh cranial nerve, which is the facial nerve, which carries taste sensation from the anterior two-thirds of the tongue, controlling facial expression and salivation. Vestibulocochlear nerve, which is two parts, the vestibular part and the cochlear part. The vestibular part is important for the equilibrium, and the cochlear part is important for the hearing. The glossopharyngeal part carries the taste and other sensation from the posterior third of the tongue, controls the swallowing, salivation. Tenth cranial nerve, which is the vagus, which carries parasympathetic nerves to the stomach, intestine, and other organs. The accessory cranial nerve controls the neck and shoulder movements with the sternomastoid muscle. The hypoglossal nerve controls the muscles of the tongue. The last four cranial nerves emerges from the medulla oblongata, while the middle four cranial nerves emerge from the bones. The spinal cord, it links the brain to the most of the peripheral nervous system. We have 31 pairs of spinal nerves. They are mixed nerves, motor and sensory, controlling some involuntary function, and they are protected by the vertebral column and the meninges, the dura, pia, and the arachnoid matter. On the contrary of the brain, in the spinal cord, the white matter is the outer surface of the spinal cord, and the gray matter is the interior part of the spinal cord. Spinal nerves join with the spinal cord through spinal nerve roots, a dorsal root and a ventral root. The dorsal root carries the afferent axons into the spinal cord, and the ventral root carries the efferent axons out of the spinal cord. As you look here, this is the peripheral receptors and the impulse through the sensory neurons to the dorsal root ganglion and the dorsal root, then to the spinal cord, and the efferent through the ventral root to the effector or the skeletal muscle to start the action. The spinal cord is formed of 31 segments, 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal segment. And if you notice that the spinal cord is not the same length as the vertebral column, as in the adult vertebral column, the spinal cord ends at the lower level of L1, the lumbar 1 vertebra. As regards the structure of the spinal cord, it contains ascending and descending axons that carry impulses and information from the periphery or commands from the centers in the central nervous system to the periphery. The ascending tracts carry sensory information up to the brain, like the spinothalamic tract, which carry pain and temperature from the periphery and ascending all over the spinal cord to end in the somatosensory cortex. The descending tracts, like the corticospinal tract or the pyramidal tract, which originating from the motor cortex in the brain and descend through the brain and decussate in the medulla and then descend in the spinal cord to end on the spinal motor cells or the anterior horn cells. As regards the blood supply of the brain, we have two systems, the carotid system and the vertebrobasilar system. The internal carotid artery, which is originating from the common carotid artery, which divides into external and internal carotid, and the internal carotid is divided into anterior and middle cerebral arteries. Those are the two vertebral arteries which are connected together to form the basilar artery, which gives off two terminal branches which are the two posterior cerebral arteries. The basilar artery also gives off the superior cerebellar artery and the anterior inferior cerebellar artery, while the vertebral artery gives off the posterior inferior cerebellar artery. So again, we have the internal carotid arteries, which gives off the anterior and the middle cerebral arteries, the vertebral artery, which gives us the pica, and the two spinal arteries, the anterior and the posterior spinal arteries, the basilar artery, which gives off the two terminal branches, the posterior cerebral artery, ICA, the superior cerebellar arteries, and pontine arteries, and the circle of Wells, which is a connection between the two systems. We have the anterior communicating artery, which is connecting the two anterior cerebral vein arteries, and the posterior communicating arteries, which are connecting the internal carotid and the posterior cerebral arteries. The venous blood of the cerebral cortex and the deeper regions are collected into large venous sinuses located in the dura, and these venous sinuses carry the blood and drain it into the internal jugular veins. By now we have revised the anatomy, the organization of the nervous tissue, blood supply, and now we'll talk about the upper motor neuron and the lower motor neuron. What is the meaning of each term of them? The upper motor neuron is the pyramidal tract, which originating in the large pyramidal cells in the motor area and descend in the corona radiata, internal capsule, midbrain, bones, cross to the opposite side in the medulla, and descend in the spinal cord and terminate on the anterior horn cells of the spinal cord, and this is the corticospinal tract. And we have another part which ends on the motor nuclei of the cranial nerves in the brainstem, which is the corticobulbar part, while the lower motor neuron starting from the anterior horn cell of the spinal cord, the anterior root, the peripheral nerve, the muscle. This or any lesion here or any part of this circuit is the lower motor. Also, the motor nucleus of the cranial nerves in the brainstem, the nuclei of the cranial nerves are lower motor neuron. The cranial nerves itself is a lower motor. The muscles supplied by the cranial nerves are lower motor neurons. So, the upper motor neuron end at the nucleus of the cranial nerve or at the anterior horn cell, and the end of the neural circuit or the remaining of the neural circuit is the lower motor neuron. So any lesion in the upper motor neuron will give a completely different picture for a lesion in the lower motor neuron. So as regard the muscle state, the upper motor neuron will show wasting, but it will be very late, and it will be as a disuse atrophy or disuse wasting, while in the lower motor neuron lesion, the lesions anterior horn cell, the peripheral nerve, and the muscle will be early marked selective wasting. The muscle tone, we have something called hypertonia or spasticity, increased tone below the level of the lesion. In the lower motor neuron, we have something called hypotonia or flaccidity. The muscle power post-lesion will give us weakness. Deep reflexes will be exaggerated in the upper motor neuron and diminished in the lower motor neuron. Clonus may be present in the upper motor only. Superficial reflexes will be lost below the level of the lesion, the upper motor, and in the lower motor at the level of the lesion. The plantar reflex or Babinski sign will give positive Babinski sign or extensor plantar response in the upper motor and flexor plantar response in the lower motor or lost plantar reflex. One of the important challenges in neurology is to know the localization of the lesion. Where is the lesion within the nervous system? And to solve this puzzle, you need to take an appropriate history and do a detailed examination to detect where is the lesion. And this is different from any other clinical field. You need logical thinking, you need detailed information, you need proper examination to reach the proper diagnosis. In neurology, we have another thing which is different from other medical fields, which is our diagnosis. Neurological diagnosis is three parts: functional diagnosis, anatomical diagnosis, and pathological diagnosis. The functional diagnosis, which is the presenting functional disturbance. The patient has weakness of the right upper and lower limbs, so the functional diagnosis is hemiplegia. The patient has weakness of both lower limbs, so the functional diagnosis is paraplegia. The anatomical diagnosis is knowing where is the lesion. Is it upper motor neuron lesion or lower motor neuron lesion? If it is upper motor, is it cerebral, cortical, or subcortical, or brainstem, or spinal? If is it a lower motor neuron lesion, if it is in the anterior horn cells, the peripheral nerve, is it a muscle or neuromuscular junction? The third diagnosis is the pathological diagnosis. What is the lesion? The nature of the lesion. Is it congenital or heredofamilial, or is it acquired? Maybe vascular cause, inflammatory, traumatic, neoplastic, demyelinating, degenerative, metabolic, and each one of these pathological diagnoses has its criteria and differ from each other in the onset, course, duration, and the presentation. And this is an example for complete neurological diagnosis: a heredofamilial cerebellar ataxia. Heredofamilial is the pathological diagnosis, cerebellar is the anatomical, ataxia is the functional diagnosis. Okay? Acute left-sided subcortical ischemic hemiplegia. Hemiplegia, left hemiplegia is the functional diagnosis. Subcortical is the anatomical diagnosis. Ischemic is the pathological diagnosis.